Introducing cannabinoid use among Americans with MS, current trends and gaps in knowledge. Multiple sclerosis is a chronic autoimmune disease. Specifically, our antibodies attack the myelin sheath of our neurons. This can cause sensory and motor impairments in our body. Symptoms vary greatly from individual to individual. Pain and sleep disturbances are the symptoms that we're going to talk most about in this article. Cannabinoids are chemical compounds found in the cannabis sativa plant. They affect our body by acting upon our endocannabinoid receptors. CBD and THC are the most well-known cannabinoids. So I decided to choose this study because our community member was referred to cannabis from others in his local MS community. This article speaks on pain, and our community member said that they haven't experienced a pain-free day since 1998. So with MS, there's always an ongoing challenge to find new options available for treating the chronic prevalent symptoms associated with it. Specifically, to find a product without side effects is important. The purpose of this article was to assess usage patterns and perceived effects of the use of cannabinoids when taken by persons with MS. The study design was a descriptive survey. So on to the methods. The researchers sent out approximately 79,000 invites to participate in a nationwide survey. 1,234 people opted in. In the survey, there was 4 main sections. The first was essentially just collecting background information targeted towards the respondents' history of cannabis use. The second section was a 0 to 10 scale used to quantify perceived benefits of cannabinoid use on select symptoms. The third section was PROMISE. This is basically a testing procedure which is commonly used in a variety of clinical research communities. All of these reported outcomes are actually symptoms of MS, so PROMISE works very well in this context. The fourth and final section was a pain detect questionnaire. So from our survey, data was collected from 1,217 participants. The mean age was 51.2 years of age. 80% of respondents were female and 88% were Caucasian. 69% of respondents reported having relapsed remitting subtype of MS. Nearly a third of our respondents actually endorsed using cannabis in the last year. 254 of those were current users. 90% of cannabis users used it for medical purposes. And interestingly, only 18% actually discussed this with a healthcare provider. More importantly, less than 1% actually received guidance. Some other results. Of those who reported using cannabinoids for sleep relief, 78% reported more than one sleep benefit. And on our numerical rating scale, the 0 to 10, our patients reported a 7.5 for relief from sleep problems and a 6.3 for relief from pain. This means that patients reported benefits from using cannabinoids in these two areas. This article also looked at if there's a benefit for using different THC to CBD ratio products. Those who used higher THC formulated products actually reported an improved ability to fall asleep. From the pain detect questionnaire, we actually found that the lowest scores were among those who strictly used THC or high THC formulated products. When we looked at the PROMISE scores, we found no significant association between the THC to CBD ratio of the products and pain intensity or sleep disturbances scores. More research is still needed to determine the benefits of using different THC to CBD ratio products. On to our critique. For limitations from a Western perspective, the quality of the cannabis products and the THC to CBD ratios were not the same across all of our subjects. This is literally a difference in the product administered, which could lead to different reported results. The frequency and amount of cannabinoid use across the respondents was not the same either. This could mean that some respondents were taking more or some respondents were taking less cannabinoids than others, leading to a difference in results. A solution to these two limitations could be standardizing the THC to CBD ratio of the products, the quality of the cannabis product, and also standardizing the dosages. A third limitation was the amount of respondents in each THC to CBD preference group. This was very imbalanced. The majority of people preferred high CBD. A solution to this would be to gather more respondents in the other preference groups. For strengths, this article incorporated well-known clinical tests, PROMISE, pain detect. It also had a wide demographic and the ability to reach a nationwide audience. For a non-Western critique, areas of improvement, this study mainly focused on physical health. It would have been nice to see how cannabinoids affect mental, spiritual, and emotional health. This study included the participants' perspective, which was a strength, and it also incorporated the use of natural plant products. In conclusion, this research article suggests that cannabinoids can be used to improve sleep and pain issues in people with MS. This is the main takeaway. However, also important is to recognize that there's a large disconnect between people with MS and healthcare providers in terms of cannabis consumption guidance. The evidence isn't clear whether having higher THC or higher CBD in your cannabis product is better for pain and sleep problems. And finally, just a food for thought. 16% of respondents decided to not answer the question whether they've used cannabis in the last year or not. This could mean that there is still a stigma out there regarding cannabis use. Thank you for listening to my presentation.